is NGOs in Pulau, Omadal, and Semporna have said that they are being tasked to inform positive patients of their status and ensure others are observing their quarantine. Why isn't KKM doing this instead in the island? What measures are being taken to ensure that the volunteers are protected from infection? Will there be a quarantine center set up on the island for the villagers who are infected and exposed?
And as for the Pusat Quarantine and Rawatan Risiko Rendah, we at the moment in Sabah we have 26 centers for treatment, and we realize that the suggestion by for us to build more centers, especially in the islands, is very challenging because we have more than 46 islands and 26 occupied. So the resources is already very challenging for us to bring our resources to the island when you do some islands do not have electricity and etc. So we prefer to bring them to the mainland so that we can set up a better in terms of health facilities to treat them accordingly. So this is a challenge that we have. As I mentioned earlier, it is a logistic issue. How do we reach out to the patient in the islands, for example, and then make sure that we can screen them and then can bring them to the mainland for treatment. Treatment means it's isolation for 14 days so that we can avoid, in terms of infection, etc.
So what about the NGOs? What's being done to protect them?
That's right. The NGO, there's two forms of NGOs. One, they go on their own without informing the Ministry of Health. They just go on their own, they do their activities. But our fear is that they will get infected, especially if the NGOs do not have experience in terms of infection control, etc. So their intention is good, but then we also need to protect the NGOs. We look into our frontliners; they also get infected. So what more NGOs coming to the ground? So we also have a few NGOs already form a cluster. Coming back from Sabah, already have a new cluster in Selangor, for example, and a few of our staff also got infected. So we advise them, the first is that if they want to come in to participate, join the Ministry of Health, so we will give them the training, the basic training in terms of infection control and etc. Second, in terms of coordination, where to go, what to do and etc. So I think there are a lot of things that we can do together, avoid duplication and complement each other. So rather than duplicate the services at the ground level.